Before I enter the patient's room, I would check their chart and the nurse's chart for the dressing type, the way that the wound looks, any odors, so that I can assess it to see for any changes. I'm looking on the door for precautions, and I'm dressed appropriately. Hello. I'll provide privacy. My name is Elizabeth. I'll be your student nurse today. Can you please verify your name and date of birth for me?
That's about 13 centimeters.
Okay. The name and the date of birth matches what's on the wristband. I see here that you are allergic to amoxicillin. Do you have any other allergies that I should be aware about? Maybe with tapes or like gels or anything like that? Okay, patient verbalizes they don't have any allergies.
Perfect. Now I'm gonna make that dressing, okay? So
I'm here today to do a dressing change on your abdominal wound after your surgery. Are you having any pain today? Are you having any pain right now? If the patient verbalizes pain, I would administer, I would try non-pharmacological and pharmacological relief methods and reassess pain in half an hour. Okay, so I'm gonna go get my supplies.
So now we're going to off that wound with that moisture and gauze.
Okay, and I'm going to clean up my work area.
Don't want it too wet, so I'm going to squeeze like that. Okay. So now I'm going to pat the wound, making sure not to introduce any bacteria. And I want it to be loose but full. That surface of that skin. So that looks good. And then
I'm gonna make sure that the patient is comfortable.
Doesn't seem like you need it at this moment in time, so I'm just going to cover with 2 pieces of 4x4
I'm going to put on some more gloves because I'm going to take a look at the wound now.
1, 2. Nice and covered. Next, I'm going to grab this ADDG cover. I'm going to put it on.
Alright, I'm going to lower your blanket down, making sure to only expose the area that I'm working on.
I'm actually going to take my gloves off now.
Okay, so I see that the nurse had her note here. That would be for my note later. I'm going to take the tape off, making sure to press the skin down. And if it's having trouble coming off, I would use saline to loosen it. So I can see that there is some serosanguinous, like minimal drainage. I'm going to throw that away. And then I'm going to take off the packing. I'm going to throw that away.
Yep, nice and stuck.
And then taking out these.
Okay, cool. So I'm going to go ahead and cover you.
And taking out these. Okay. So I'm looking at the wound and I don't see any signs of purulent drainage inside. And the skin on the outside looks pink, which is normal for a healthy wound. And the wound on the inside looks red and beefy, so which is also good. Okay.
See? We made it. You made it. You did so good. You did such a good job. Okay, it's nice and clean and everything. Are you feeling any pain on the
No pain.
No? Okay. And
I'm going to measure the wound.
No questions.
No questions. Okay. Nice and clean.
2.5 centimeters deep.
Okay, just I'll if you need anything, okay?
It's about 2.5 centimeters wide.
Okay.
Sounds good.
Slay. Did I miss anything?
No, I don't think you did.
And then
I
about
was, like,
13
doing, like, I was
centimeters
tracking
long.
my head as you were going. I know, I was like, because I forgot to do that.
I know, I was scared because I was like, I don't know what that means, but I'm gonna guess it's the right. Okay, cool. Yeah, thank you for being sick and awesome. Thank you for being sick and awesome.
I might have to show you one more time. I think I can.
Oh, yeah. Do you think it'd be okay if you took a moment to look through our videos?
Yes.
So, I'm glad you self-corrected. You do have time,
I'll go ahead and.
you know, so if you do it again and do it correctly.
The thing from the nurse manual.
That's eco-friendly.
We are. Very eco-friendly.
Yes, that's, yeah, we've been using her chart, so just go down to rooms, drains, whatever it was, new entry.
Can't forget to go on the card cover.
I just wasn't
Oh,
sure
yeah,
if
we have
it
the
would
document, yeah.
show for everyone.
Even though it's gonna be
I think
really
so, no.
That's okay.
Where'd he go?
Just in case.
I love you.
I'm gonna take my materials out. Gonna pour
I
saline.
wish nursing was like this stuff. It's gonna be a whole different personality, a whole different.
Yeah.
It's not just this.
It's not just, yeah.
Plus, I thought in ETI it said that you don't do wet to dry. Some people do, but it's not like best practice.
Oh, really?
Okay, now I'm going to pack the
I
wound.
remember reading it was like, so the benefit is, it's like good for debris hurts, cause like it dries, and so when you clean it off, it like pulls all the nasties. But they say that it's bad because it also pulls like the good skin cells. I don't know. That's what ETI said, and I trusted ETI with my life.
Yes, because
Sometimes.
they a mess.
They are a mess sometimes. Things are misspelled, like,
They are.
pretty frequently.
I noticed that too.
I'll be like, huh? I think they meant this. Sarah Sanguinus. I was so embarrassed during clinicals though. My nurse like kind of gave me homework, and it was she had me look up meds for like patients outside of like basically all her patients. And she was like, well, I give meds, I want you to give them
Okay.
client education. So she would give me
And then I would dry the outside skin and apply ointment if it was ordered. I don't see an order for that right now. So I'm going to put on 2 or 3 of these 4x4 gauze
This
pads.
happened to be like a pharmacy tech, and so she was giggling. She was giggling at how I pronounce things, and I was like, I'm sorry.
Let me lift my leg. Okay.
I was like, let me get better. Okay. I think
Making sure to get a few inches outside of the wound. Okay, I'm gonna put this abdominal pad so that the blue line is facing up. remove my gloves. I would make sure I have enough tape. I would tape the pad this way and across this way and this way. And then I'm gonna write my name on this note. I'm gonna put my initials and today's date and time. And I'm gonna put it on top of the dressing. Just cover them up. And how have you been feeling? Have you been having any pain? The patient verbalizes that they have not been having any pain. And I'm gonna clean up this bag. Okay. I'm going to put them in their lowest position. I'll make sure they have their call light. Cleaning up the rest of my supplies. And then I'm gonna go document the appearance of the wound, the drainage type and amount, and the dressing type that I applied, and how the patient tolerated the procedure or the dressing change.